So today we'll be presenting you our project as the representatives of the delegation of Morocco in the World Health Organization Assembly. So as we all already know, yeah, Morocco is a third world country in the north of Africa and is considered one of the oldest kingdoms in the world. It is known for its rich history and cultural diversity, including traditional clothes and foods. Some people still describe it as a third world country. However, this term is outdated, and it doesn't really reflect the modernization efforts. In fact, Morocco will host the 2020 World Cup, showing its huge capacity for development and international cooperation. Despite this progress, when it comes to health, challenges remain. In this presentation, we will focus on the health sector, particularly maternal health, in more detail in the next slide. So, first of all, we will be talking about the maternal mortality rate. Morocco has reduced its maternal mortality rate significantly over the last 2 decades, from 2027 deaths per 100,000 live births to 72. But in 2025, recent cases of maternal mortality have risen a lot, and were specifically reported in several regional hospitals of Agadir and Limina, which caused a lot of commotion in the streets. 8 women died. The main obstacles of the health system are the staff shortages. In 2025, there are about 7 to 8 doctors per 100,000 inhabitants, and there are low wages and social determinants and regional inequities. The national priorities are to improve access to maternal health care in rural areas, train and recruit more doctors, upgrade hospitals and maternity centers, and increase the health funding, as well as promoting women's education and family planning. What we request from the WHO is financial and technical support for bigger infrastructures, training programs for medical staff, support for rural health care projects, and access to modern medical equipment, as well as health system strengthening programs and data and research collaboration from other countries. In conclusion, maternal health is a human right, and a lot of progress has been made, but the challenge still remains. Morgan is committed with the World Health Organization for global partnership. Okay, and that's it. Thank you so much.
Okay.
Honorable Chair, distinguished delegates. Japan stands today as one. What makes our story worth your attention is not our technology or prosperity. It is the paradox we live with. We are a country that built universal health coverage, trust in public health, and strong social systems. Yet we are also aging faster than any other nation. Japan reality is a reminder to all of us. No country, no matter how advanced it is safe from the pressures that can threaten maternal health. Still, Japan maintains one of the lowest maternal mortality rates in the world, with 3 to 4 deaths per 100,000 deaths live births. That is the result of intentional policies choices: universal coverage, advanced medical network, a culture of prevention, and infrastructures that protects mothers from infections and unsafe diseases. In Japan, giving birth is safe because we made it a national priority. But our success still faces some deep fractures. Our population is aging faster, our providers are overworked, and rural areas struggle to keep even one doctor. The workforce is stretched to its limits. Japan's real wages has barely moved for decades, with an average salary of $2,000 per month. Tokyo and Osaka thrive, while entire villages disappear in rural prosperity. In some areas, reaching emergency obstetric care can take dangerously long. 70% of national hospitals and 86% of municipal hospitals operate in default. Facilities are aging, staff are exhausted. Loneliness is crowded in crowded cities, demanding work culture, rising inequalities, pollution, digital exclusion, and rural medical deserts. These forces decide who survives long before any doctor intervenes. But Japan priorities response to these challenges. First, we manage an aging society through strong community support. Secondly, ensure long-term insurance sustainability. Third, strengthen preventive and community-based care. Accelerate digital health and medical innovation, and reduce workforce through reforms and better initiatives. And lastly, improve emergency preparedness and reinforce Japan's global health leadership. So today, Japan urges the WHO to first lead a global data revolution on social determinants of maternal health. Should I stop? Oh, especially in conflict zones. Secondly, support adaptation of Japan's MCH handbook, a proven tool for continuity of care from pregnancy to early childhood. And thirdly, help countries design workforce strategies, expand midwifery, and implement telemedicine like spoke and hub systems that link rural providers with specialists. So, distinguished delegates, Japan's experience teaches us two lessons. Maternal death is preventable and progress is fragile. A country may build its strongest system in the world, yet still risk losing mothers if it's ignored by the social government. Japan stands ready, not as a model to be admired, but as a partner committed to action. We believe that every woman, from Tokyo to the most remote part of EMRO, deserves safety, dignity, and the promise that giving life will not cost her own life. No woman should die while giving birth. And together, we can make this global truth, not an exception. Thank you.